So good morning, everyone, and welcome to the Community Engagement and Youth Voice Breakout Session. My name is Samantha Anthony, and I am a health question scientist in the Child Health Evaluated Sciences program here at the Sick Kids Research Institute. I'm also an associate professor in the Factor Inwintosh Faculty of Social Work at the University of Toronto. Capturing the voices of children, engaging patients meaningfully, and focusing on patient-identified priorities have all been key principles that have guided my program of research, which centers on establishing an evidence-based foundation for successful psychosocial adaptation and enhanced quality of life for individuals with chronic illness. I am delighted to introduce my co-moderator for this session, Priscilla Medeiros. Priscilla is the Knowledge Mobilization and Community Engagement Specialist for the Edwin S.H. Leong Center for Healthy Children. She has passionately led community-engaged research and the implementation of research findings into practice for over 10 years. Recent highlights of her work include co-leading efforts to educate healthcare professionals using a women-centered HIV care model.
Thank you so much, Samantha, for the welcome. Welcome, everyone, to our session. I briefly want to run through our agenda for today with you. So we have 40 minutes worth of wonderful didactic presentations by our speakers here where they're going to highlight the great work in which they're embarking and within their own communities and the ways in which we can learn valuable lessons from them and strategies we can move forward within our own work as well. We'll then shift into something a little bit different, into breakout groups, which we're very excited about. You'll have the opportunity to intermingle and a bit more intimately interact with our speakers, engage with them, asking questions directly related to their work, as well as how it underpins and intersects with your own. And then we'll wrap up this session with closing remarks, as well as any additional burning questions that you might have for our speakers and interrelation to the theme of today as well. So we'd like to first start with introducing our speakers, Tanya Sharpe and DeShawn Hibbert.
So again, we're incredibly excited to welcome both Tanya and DeShawn as our first speakers for this session. Tanya is a professor also at the Factor Inwintosh Faculty of Social Work at U of T. She is also the founder and director of the Center for Research and Innovation for Black Survivors of Homicide Victims, a multidisciplinary initiative designed to advance research, policy, practice with Black survivors of homicide victims throughout our global community. DeShawn is a father and has ambitions of working in the community as a social worker. He served as a neighborhood ambassador and storyteller for the Invisible Wounds Project, led by the Center for Research and Innovation for Black Survivors of Homicide Victims.
Oh, that's me. Okay. Yeah. All right. Hi. Good afternoon, everyone. And thank you for that kind introduction. It's truly an honor for us to be here today. And we want to personally thank the Leong Center for Healthy Children for extending the invitation. For the past 20 years, I've been developing a program of research for and in collaboration with Black surviving family members and friends of homicide victims. A topic that has real-world implications to spaces and places throughout our global community. Chicago, Illinois, Johannesburg, South Africa, Kingston, Jamaica, Baltimore, Maryland, and right here in Toronto, Canada. In short, no one is immune. But I'll circle back to that in a moment. Before I begin, I think that it's important that you understand what drew me to this work, my calling, if you will. Before entering grad school, I was working at the Harvard School of Public Health, Division of Public Health Practice, working side by side with families and friends who were surviving the homicide of a loved one. I was working with them for the purpose of developing violence prevention programs, and it was during that time that I met Edna. And Edna's son had just been murdered. A bunch of us who worked with Edna attended the funeral to pay our respects. And as I entered the church and I approached her, I extended my hand and said, "I'm so sorry for your loss." Edna looked at me with disdain and said, I didn't lose my son. He was taken from me. Her words struck me. They struck me to my very core. And it was in that moment, that exact moment, I knew I was called to do this work. In that moment, two things became abundantly clear. If I, as a trained social worker, even with the best of intentions, did not know how to help her or to support her, how equipped would other service providers be? The next thing I thought about was, how would Edna cope with the murder of her son? Now, Edna's story is not unlike the surviving mom whose son had just been murdered 1 month prior to my meeting her after delivering the keynote address at the inaugural Survivors of Homicide Victims Conference here in Toronto. And all I could do was hold the space for her pain. A few years back on a trip to Boston, I saw Edna again, and I ran over to her with excitement. I wanted to tell her that I kept my promise, that through my work, I'm uplifting the voices of so many who feel voiceless. That familiar weight of sadness clouded her eyes. And she grabbed my hand and she said, "Tanya, I'm so glad, because my son Leonard, Edna's youngest son, was murdered last year. Time is running out," she said, "and we need you." So I'm very clear that the work that I do, the work that we do, is in service to them, the survivors whose wounds are not visible to the naked eye, but in the absence of culturally responsive interventions, are often left to fester and never heal. I want to provide some context relevant to homicide throughout our global community. On average, each year, 17,000 murders occur in the United States. And what you'll hear many people say is that compared to other forms of violent victimization, that number is fairly low. But when you think about who the majority of homicide victims are, young Black men and women living in urban areas, and when you realize that although African Americans make up 14% of the population, and yet they account for more than half of homicide victims, and when you understand that on average African Americans experience the homicide of a loved one at least 2 times in their lifetime, you begin to realize that we are dealing with an epidemic that disproportionately impacts some of our most vulnerable communities. Now, this overrepresentation of Black homicide victims is not unique to the United States. In Canada, on average, 600 murders occur in Canada each year. And out of the 13 provinces and territories, the numbers of homicides is often highest in Ontario. In 2019, StatsCan released data indicating that racialized populations accounted for 75% of homicide victims in Ontario, 44% of whom identified as African, Caribbean, or Black. In Jamaica, on average, Jamaicans experience 1,500 murders each year, 9 times the global rate. And on average in South Africa, South Africans experience 18,000 murders each year, 7 times the global rate. Now, Redmond and Doka suggest that on average, each homicide victim has at least 7 to 10 family members and friends struggling to survive and cope with the murder of their loved one. The numbers alone, however, don't allow for us to see that for Black people, our relationship to one another extends far beyond blood ties and country borders. So the ripple effect and impact of homicide is far-reaching, suggesting that the number of family members and friends is far greater than research predicts. In addition, when we consider the frequency in which homicide occurs in Black communities throughout the global diaspora, United States, Canada, the Caribbean, Africa, Brazil, you begin to understand that we are dealing with a disproportionate number of Black people who are struggling to make sense out of that which is senseless. The absence of acknowledging chronic and cumulative Black death obstructs our ability to comprehend and respond appropriately to the traumatic impact homicide has on family members and friends of homicide victims. Moreover, neglecting to acknowledge the chronic overrepresentation of Black homicide victims is yet another form of victimization. Truly valuing Black lives requires engagement and thorough assessment and candid conversations about the root causes and consequences of homicide for Black communities. The Center for Research and Innovation for Black Survivors of Homicide Victims was established so we can respond to these formative rifts by utilizing community-engaged approaches to advance culturally responsive research, policy, and practice. Our values, vision, and mission statement are rooted in these core principles of community engagement. Community engagement research provides us with the opportunity to reduce service inequities for and in collaboration with marginalized communities and advances our ability to be culturally responsive in our continuity of care and services. We at the CRIB define community engaged research as the purposeful collaborative involvement of Black survivors of homicide victims and their service providers, you, in the development, implementation, and dissemination of research, policy, and practice. In fact, our core values, cultural humility, from the community, by the community, are rooted in principles of community engagement. And in my opinion, community engaged research is not something you do. It's not something you do. Done well, it must be essential to who you are to create and sustain impactful work. So DeShawn, I want to know from your opinion as a neighborhood ambassador at the CRIB, what is your understanding of community engaged research?
My understanding of community engaged research is it's about the deployment of our ambassadors into these communities that we are trying to help. The deployment of these ambassadors that we're going to go into these areas and become pillars and try to be pillars and partners with the community to help grow, to help set new boundaries, to help see what is possible. Community engaged research to me also is about just being together, inclusive, having people involved. You know, like sometimes things happen in a community and people don't know they can be heard. People don't know their voice is able to be amplified when you get together. People say there's power in numbers. I think there's power in numbers for sure, and definitely in research numbers when you come together as a team, you know. And when people that are on the front line being affected by certain things, these problems, get to be a part of the research, be a part of the solution, be able to echo, to amplify their voice at the time when it means most. I think that's community engaged research, when you really engage with the community, when you let them feel engaged, when you let them feel a part as well.
Well said. So when I think about the why is this important? Why is community engaged research important? I think about Ken Hardy, who talks about this whole idea of seeing, being, and doing. And typically as a society, we are more reactive than proactive. And we see something, we see an atrocity, we go right to doing. Community engaged research allows us this really unique opportunity to center the voices of those who are impacted and leverages those power dynamics, that structural inequity, and also allows us to really think about creatively. I was just talking to Cindy Blackstock and I was like, I firmly believe that the communities know the answers. They know the answers to the problems. Lots of times we're just not listening and we're not necessarily taking action. Community engaged research allows partnership to start from the conceptualization to the development to the implementation, as well as to the dissemination of results, as we're doing here today. DeShawn, but particularly I want to know, for Black survivors of homicide victims in communities, why do you think community engaged research is such an important modality for doing research?
I believe in times of when we're talking about Black survivors of homicide, and those times specifically, when you engage with the community and the community feels engaged, you give somebody a role, you give somebody a position, you give somebody that ambassador title. There's not too many people that understand like how much can be done as an ambassador, how much can be done as a pillar, a community pillar. That's what we're looking for. That's what we are trying to establish in these neighborhoods. So the community engaged research part, I believe, is just supremely crucial to like the building of leadership also in the community, the building of partnership in the community. And those things just help to a positive future, help to a better outcome, help to let people in the community, in the roughest situations, understand that, you know, when we group up together, things can be done from the lowest level. Sometimes we always think it has to come from the top down, but it can also go from the bottom up.
So one of the things we wanted to talk about as well is how do we, particularly at the crib, how do we conduct community engaged research? And it really starts with, again, cultural trust and cultural humility, understanding that we know some things as university professors, but community folk who have tremendous credibility, they have knowledge and expertise that need to be shared and created at the very first. So that's really one of the core values. And then we think about defining the problem. What was really important on some of the projects that we'll talk about, Invisible Wounds and Survivors of Homicide, Victims of Mental Health, and forthcoming the In the Aftermath project, was essential that we got together with service providers and survivors of homicide victims to define what the problem was. It wasn't just, and what they revealed is it wasn't just about experiencing. On average, our data is saying at least 3 times, on average, individuals, African Caribbean Black individuals in the GTA are experiencing the homicide of a loved one at least 3 times in their lifetime, because they're experiencing the murder of someone here in Regent Park, they're experiencing the murder of family members in the United States, and they're experiencing the murder of family members in their home country. And so we weren't just talking about the atrocity of that hard trauma, but they were talking about the underbelly of anti-Black racism as a chronic trauma that is also influencing their ability to access the services, what their experience is like bedside in hospitals when they can't go visit their loved one because they're not necessarily related by blood, but they've been caregiving for that individual since they were 2. The other thing was study design. Neighborhood ambassadors were played an intricate role in understanding how do we go about, do we want to do a qualitative study only? Do we want to do a mixed method study? Will they collect the data? So they helped us develop the semi-structured interview guide. They actually conducted the focus groups with us, and they analyzed the data, and they're actually publishing the results with us as well. And so recruitment and retention, they talked about the spaces and places that we would go. I had this beautiful map, folks, mapped out based upon data, Toronto Police Services data, neighborhood data, and they were like, no, you can't cross these boundaries, right? That was critical to being able to implement and recruit participants. Instrument design, again, as I talked about, whether we're going to do qualitative, quantitative foremost. Data collection, they were instrumental in collecting the data with us. And then analysis and interpretation. We actually were able to go through the focus group data with them and sort of saying, is this what you're seeing? Is this what you heard in those focus groups? So doing a lot of member checking and peer analysis. And then again, dissemination accessibility of results. Yes, we're going to do peer-reviewed publications. Yes, we're going to present at conferences together like we're doing, but we're also going to present some of those findings to the community in some film screenings as panel discussions of the Invisible Wounds project, which we'll talk about in a moment. So, the crib community, one of the projects that I want to actually highlight that 3 of them that used community-based research, community-engaged research, was the Survivors of Homicide, Victims and Mental Health project, where we actually partnered with service providers and survivors, again, at the onset. Service providers were a part of our advisory board. They were a part of creating our survey that we disseminated to 87 service providers throughout the Ontario province to understand how are individuals feeling about their ability to be culturally responsive in the delivery of services to Black survivors of homicide victims. And then the survivors came together with the service providers to be able to not only participate in focus groups, but to actually work together to create 10 policy recommendations that we are now putting forth, again, to various ministries and working with the Canadian Black Policy Network, as well as the Policy Bench for Indigenous Communities. The Invisible Wounds Project project, which consisted of survivors of homicide victims as well. They conducted focus groups. A subsample of that group participated in digital stories, again, for the purpose of not only just creating a digital story, but in the purpose of informing an intervention and developing a model of that we could actually begin to implement. And then 30 at 8:30 was a unique and innovative way where it's an Instagram live show where every Wednesday night for 30 minutes we hold the space with community and as well as other faculty doing the research to disseminate those results. Again, forthcoming is our In the Aftermath project, funded by the Leong Center, where we'll work with young Black survivors of homicide victims ages 12 to 16. Again, engaging them in the same process. And with that, thank you so much. Go up there.
Thank you so much. I'd like to thank Tanya and DeShawn for sharing a little bit about the incredible work that they're doing in the community. We'll obviously have an opportunity to chat with them a little bit more during the breakout activity. But I'd like to hand over now to Stacie Smith and Raissa Amany as our next speakers of the session. Stacie is the Executive Director of the Young Canadians Roundtable on Health, and she's also the founder of the Mental Health Student Support Network, groundbreaker with Frame, and a co-lead for the Mental Health International Youth Advisory Committee. Raissa is currently pursuing an undergraduate degree in health sciences at the University of Ottawa. She's also the co-executive director and project lead for multiple projects about child and youth health with the Young Canadians Roundtable on Health as well. So a big round of applause.
Thanks so much. Hi, everybody. There we go. Thanks so much for having us here today. We're really excited to share a little bit more about the importance of engaging youth and co-creation in research. So I think we'll just get right into it. So we just wanted to acknowledge the land that we're on. So we would like to acknowledge that the land in which we gather in the traditional land of the Huron, Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. So a little bit about me.
You know yourself.
Yeah. I do know myself, but I am an East Coaster. I'm from St. John, New Brunswick, currently live in Fredericton, have a background in kinesiology and education. I've been in this role since 2020, so right around when the pandemic was really happening. I also, no, I don't have this on here, but I also work with Partners for Youth as a youth mental health project coordinator. Also working in various engagement roles as well. And I went to Europe this past September. I thought a fun fact for the very first time, which was really fun. Got to see some really cool things. So it's a little bit about me, but I'll pass it over to Raissa to talk about herself.
Thank you. Hi, everyone. Nice to see you all. So what Priscilla said, I'm pursuing my health science degree at the University of Ottawa. University of Ottawa. I wear many hats within the community, one being the co-executive director of the YCRH. I'm also a youth advisory committee and a research partner with the Knowledge Institute of Child and Youth Mental Health, KMH, and Frame. I also do research work around resilience and along with G1G, Mental Health International. And my fun fact is I overanalyze wrongdoings in medical shows.
So a little bit about the Young Canadians Roundtable on Health, or YCRH. So we are a national youth-led advisory committee that really provides youth perspectives on child and youth health in Canada and also participate in decision making. So this could look like research, policy, advocacy. It really looks very different depending on the subject. So we work in partnership with the Sandbox Project, which is a national child and youth charity that provides admin support to us and really helps us find all the amazing partnerships that exist. And yes, I'm going to call out Quincy, who is here seeing us today from the Sandbox Project. So thanks for his support all the time. We're made up right now of over 70 youth from across Canada between the ages of 15 and 32, from coast to coast to coast. So from Vancouver, BC to St. John's, Newfoundland, even in the territories, we have youth representation, which I think is really important to have everyone from every corner of the country. So our objectives. So really our main objective is to be Canada's strong youth voice when it comes to these child and youth health issues. We do lead our youth in creating different projects and initiatives related to these various topics we have here, whether it's resiliency, mental health, or injury prevention. There are lots of different things. We try to create opportunities to support these youth internally and also with external opportunities. And we also love to develop new relationships and partnerships with folks. So looking forward to having those discussions later.
So we base a lot of our work around youth engagement on the United Nations Convention on the Rights of the Child. I won't go into much detail about them, but I'll highlight the two articles that we talk about always, one being the article number 12 and one being article number 13, which 12 states that parties shall assure to the child who is capable of forming his or her own views to the right of express to those views, and also with having the right to freedom of expression. And a lot of research more currently is there's strong evidence that empowering youth voices can facilitate engagement and partnership in health spaces, and they can actually lead to better health outcomes. And those outcomes are also related to social determinants of health, such as obesity, chronic illness, substance use, mental health, you name it, right? And this is a sad fact, but according to the UNICEF report card 16, Canada ranks 30th out of 38 wealthy countries when it comes to child and youth well-being. So imagine that. So how do we define youth engagement? And I always pull out the trusty source from the Knowledge Institute for Child and Youth Mental Health because they have really good resources around youth engagement, but this is their definition. So youth engagement is about empowering all young people as valuable partners in addressing and making decisions about issues that affect them personally and or that they believe to be important. So the one thing to highlight here is that, even though we have our own agenda and we want to engage them in the research that we want to do, but you have to make sure that you listen to what they believe in as well.
So what does meaningful youth engagement look like? Well, it does look different depending on the project or initiative you're working on. So some things that we have found to be really meaningful is an active and intentional partnership between youth and organizations / adults, and ensuring youth are involved in all parts. So this could look like co-creation, which we'll talk about more, and youth having the chance to voice their perspectives and ideas without judgment. And they're the experts at the table. They're the ones with the lived experience, lived expertise in whatever area we're focusing on. Initiatives and programs incorporating the ideas and experiences of youth, which I know just mentioned. Youth getting to build our knowledge and skills through engagement. We always ensure that we have professional development opportunities for our young people in the YCRH so they can learn things that they'd like to learn about and use in their careers and in their schooling. We have to ensure youth engagement is long-term and resource intensive, so making sure that you have the resources you need to have it to be successful. So I'm aging out of being a youth, if not already. So the importance of the youth-adult partnership, I think, is something that we really have a great relationship with.
That'll happen.
Oh, okay.
Interesting.
We'll
read it out, yeah.
Yes, so we have a great youth-adult relationship with the Sandbox Project. It's a great example. There's lots of reciprocal benefits, such as skill development, empowerment, and social engagement. It really increases the feasibility in youth friendliness and ecological validity of the research, and engaging youth in meaningful ways to inform the planning, design, and execution of research projects. So great examples are a few projects that we have going on right now. One that I'm a part of is a great project between Dalhousie University and the University of Calgary around children and youth and supporting them and their families post-COVID. So I've been a part of the entire process, have had my name on publications, which is really exciting, being part of the review process and manuscripts. It's really just been a really great partnership. And the adults can be utilized as mentors and resource. So our CEO, Christine Hampson, is always there for us to provide any expertise or knowledge and resources, which is really great.
So by engaging youth authentically, the research that you conduct about them, you can increase the applicability, feasibility, and youth friendliness and ecological validity. So like what Tanya and DeShawn has said earlier, right? You bring the work back to them because it applies to them, right? And when adults participate meaningfully with youth and see the value of it, they can feel more confident and create further opportunities for engagement. So it's kind of like that doorknob effect, right? Like once you open up a door, another door opens for more engagement. So process of youth engagement. So these are just a brief summary of the youth engagement, but ensuring that youth are involved from the very beginning. So if you are going to apply for a CAHR grant, Sharpe, whatever it would be, start them from the very beginning. So list them as a knowledge user, for example. Co-creating plans of actions, and ensure that they have decision-making power at all stages of the project. So don't just be in the middle being like, hey, can you input now? But really have them from the very beginning throughout the whole project as well. Getting to know the youth, ask questions, right? And listen, may encourage them to open up, right? There is that power dynamic that you have to realize between researchers and individuals who are as an advisor, right? So open up, icebreakers. And this is really important, meeting youth where they're at. You know, it tends to it frustrates me sometimes when people say that, oh, I want to engage a specific type of, communities, but, you just put them out on social media, but we're not really reaching them where they are at. You can't just tell them to come to you. You have to come to where they are. And lastly, allow for leadership opportunities, right? So giving them the opportunity to write parts of the manuscript, for example, gives them the idea to test out any skills that they will always wanted to learn.
So we want to talk about our experiences of being co-creators. We've had a lot of those opportunities. So for myself, I've had a chance to work with the Canadian Council for Youth Prosperity, currently working on the advisory committee around the gap year that young people take between high school and university, so trying to inform that. I've done several research projects and initiatives with KMH and currently am now. Most recently, I'm working on one around vaccine hesitancy and providing educational resources on that. Frame, a great knowledge mobilization mental health network. I'm a groundbreaker, like was mentioned with them. Do a lot of great things with them. Currently part of their knowledge mobilization fellowship. And of course, I'm also actually working with Dr. Woodgate here on the Engage University of Manitoba project around creating art-based tools. I'm probably going to get this wrong. Art-based tools. Around virtual art-based tools around mental health. And lastly, Wisdom to Action. I had a chance to be part of their project around youth suicide prevention, which was really great. So lots of vast different experiences.
Yeah, so for me with the KMH, I'm currently part of their bundle of care. I know that's been across pediatric emergencies around mental health care. With the Knowledge Institute, I'm involved in their CAHR currently looking at health services, mental health services. And lastly, with their Life Research Institute, so that's with the University of Ottawa, I've been involved for the past couple of years with their older adults and longevity research. So that's a bit of what I do.
So I'm going to talk a little bit about a project that was done within the Sandbox Project and the YCRH called The Importance of Youth Voices. This was spearheaded by former co-executive director of the YCRH at Leong. So I helped out a little bit around conducting environmental scans of youth advisory committees that related to children and youth health. And we conducted one-on-one interviews with around 40 YACs from across the country just to get a sense of what has worked for them in terms of youth engagement strategies and what hasn't worked for them. Taking all that information and coming up with those meaningful youth engagement strategies that we talked about at the beginning. We did some analyses on this and created a report based upon this, which we'll touch on. But I'm going to get into a little bit more about specifics around what these YACs were. So we interviewed 20, found 41. Most were local in Ontario, a few national and provincial. So some of these topics were just general youth health, mental health, urban health, etc. Really big shout out to Vidi Desai, who's a general member who made this wonderful ladder based upon
The Hearts Ladder.
The Hearts Ladder. I'm forgetting everything. Yeah. So of course, you hear this all the time, ensuring youth engagement is not tokenistic. A lot of relationships tend to just include youth for the sake of it. So ensuring that they're actually involved in the process and used not just at the end, but through the entire project or initiative. So a few strategies. So ensure that both parties understand their roles in the project. That's feedback we get from our membership. Is they don't understand what the role is supposed to be, so we just make sure we clarify it. Co-creating a terms of reference. Our group made our terms of reference that we have within our YCRH of how we govern, which I know people have used as examples for their organizations. Ensuring they're being honored for their work, what they're doing, so honorariums, letters of support, volunteer hours, and co-evaluating what works and doesn't work. Just a few references, and our last slide. Yeah, just if you'd like to stay connected with us, here are socials. Probably connect on LinkedIn since Twitter's about to, be done in a day or two. But there's our website, and we'd love to connect with you.
Yeah, there you go.
Thanks so much.
Thank you, Stacie and Raissa, so much for providing an amazing overview of YCRH, all the tremendous work you're doing. So it's my pleasure to introduce our final speaker for this session, Roberta Woodgate. Roberta is a professor in the College of Nursing at the University of Manitoba. She is a Tier 1 research chair in child and family engagement, in health research and healthcare, and a leader in child-centered methodologies. She has been a leader in engaging children and their families in research for almost 20 years, applying arts-based approaches that amplify the voices of children and families most affected through her research program, which we already heard a little bit about, Engage. Thank you very much.
And thank you. And Stacie, thank you for doing the land acknowledgement. Really appreciate it. Really appreciate everyone being here today. I'm going to talk to you about my history in working with young people. It's been a privilege over the years. And I hope I have many more years to continue to work with them. And you'll see there's some handouts. That's my youth engagement and research framework, which I developed by interviewing young people, but also all the years of working with young people. How best to engage people, what needs to go in there, and so on. So I'm going to talk a little bit about that as well at the end of my presentation. So again, Stacie, and thank you again for talking about the UNICEF report card. I just want to bring this out. We keep on dropping every time they do this report. And of course, you look at the numbers, I think part of it has to do with the BIPOC population being impacted on. But for a wealthy country, we're not doing good. And what this report also gave 3 key recommendations about how to improve the lives of children. Oh. Okay, I guess I'm not.
Yeah.
Okay now? Okay. So the 3 things, how to be, sorry to do 2 things. Okay, so a key one is the middle one, listening to children and youth. And throughout my career, that's something that's always been very important to me. My research and program titled Engage, it's about involving children, youth, and families, as well as other researchers and so on, but especially involving children, youth, and families in areas of their lives that impacts them the most. They need to be up there, up front, right at the very beginning. When I first started doing this, and when I see Engage as almost like a ladder of steps. When I first started doing research, it was in the days when people would, either parents would be the voice of the child, or the school teachers, or so on, or it would be where the child would fill out a questionnaire. But I know I started out as a clinician, and I thought we're not really listening to children and young people. And I may use the term back and forth, but it's all young people is what I really mean. But so that's really spurred me on to go back to school, because I wanted to do research that was really coming from the young people's voices. So the type of research I started to do was qualitative research, and there would be papers saying, no, kids can't talk about the experiences. They don't have that cognitive ability. All I know is this: if a child has experienced something, they can talk about it. It's like if I have an adult talking about something they haven't experienced, it's going to be like you'll get 2 words out of them. So, and it's upon us to be able to facilitate them telling their story. And I have to admit, when I first started out, and I think I have one paper about this, and I feel totally embarrassed, because now I would say it's about giving a voice to a child. That is so wrong. Nobody gives, and you can still hear that today in the news about giving voices to people. We don't give voices to people. We're there to amplify the voice, to create the space. And I have now, I mean, that was my error, but I learned over the years as well, like I've learned from young people. So again, my research program is about engaging young people. I do think what I've learned from doing the qualitative research has really helped me to engage young people in young people as co-researchers. Okay. Oh, is it moving? I didn't do. Okay. So, just going to say my research program also is grounded in a human rights approach. So I'm just going to move on to the next. For some reason, is it?
Are you clicking?
Oh, I'm not touching it.
You're not touching it.
Okay.
I will let you click it.
Okay. Good.
You
Okay.
want me to click it for you?
Yeah. Yeah. Actually.
Sure.
Okay.
You just tell me when to go.
Go back to the next. Go back to. Yeah, good. Okay, so I just want to emphasize about it being grounded in human rights. And again, it's our responsibility to really ensure that we have young people participate and share their views. So next slide. Again, I started with moving from research on, my focus was moving research with children instead of on children. And just as one of the young quotes from a 10-year-old from one of my research studies, I forget which one, but I liked what she said at the end. And I want to help people to know that they can even trust a child, even though they're young. So just one of the things that has come from them. And again, now I see my research moving to research with children, but also with research by children. And this photo was just taken from one of my young people in a study that looked at young people experiencing anxiety. Just want to share a couple of quotes that some of the young people over the years have talked about the reason for participating. And young people, just like adults, they want to get their voice out there. They want to make it better, for the most part, for other young people experiencing similar situations. So in working with young people, be it with young people as research participants or as co-researchers, I really think it's important that you create that environment so that they can share their story for them. So over the years, I've really tried to use creative strategies. I do a lot of arts-based methodologies, photo voice, where we interview young people, have them go out and take photos of their world, and then come back and interview them. And I'm just going to share just a couple. This was from my youth voices in the anxiety study, and young people, they took just fabulous pictures. And for this study too, I also had a youth advisory committee advising me throughout the study. And so you can just read the quote yourself about what this photo represented about, living with anxiety. And then the next study is a photo. This is the young girl's actually painting that she took, and then she took a photo of it about this whole overthinking experience. And again, it just shows you from this study, I can't tell you the number of photos that I was blown away from them. And it just shows again, young people, if you create the space at any age, they can tell their story. And then again, just a brief, I'm going through these fairly fast. This is where I had a computerized drawing tool where young people living with cancer, they would draw pictures of what it's, and I don't have the quotes to this, but I think you could just look at this and a picture is worth 1,000 words about, how they felt, and then also being in a prison, how they felt. For my youth anxiety study, for the Youth Advisory Committee, when we sat down, we got to the knowledge translation part of the study. I said, we had so many findings. What do you want out? What would you like to see out there first? And they really stressed about, we want to have people understand what it's like to live with anxiety. So we took 5 of the major themes from the study, and I worked with the Royal Winnipeg Ballet Aspirin program. That's where the young dancers come in who are learning to be dancers. I worked with a choreographer, and we created 5 themes that the young people picked that they wanted represented. And these dance videos are on YouTube, and we have them in French, English, and Cree, just to try to get out there as many people, young people and the public to understand. But what we did too as well, that for the youth advisory wanted the photos and also the videos to be seen in public. So at one of our theaters in Winnipeg, in the Gas Station Theater, we planned for the youth advisory committee, we planned for evening out to showcase the ballets, also the photos. We had the choreographer on stage, some of the young people who are on the Youth Advisory Committee, and we also had some of the dancers, and we had a question period after we showcased the videos. And in the audience, there were many of the young people who participated in the study, and that was a real big step for some of them because they were living with social anxiety. So to be able to come to a theater and to have this shown, and I just want to say, when we planned this event, it was planned for January. Everything was rolling into place, and what would you think? We had a major Winnipeg winter storm that night, but we had 120 people attend the event. So that really, so it just shows. So and another thing that the youth wanted to do was develop a zine. So we developed this photo voice book of the well, that's not the photo voice zine, but you can go online and we'll show that there'll be different photos representing what the young people experience. So I'm just now going to talk more, move down into that framework that I developed with young people about engaging them in research. I think it's many of what has already been talked about has been stressed and maybe said differently, but I think we all have we adopt the same principles. I'm just going to go through these. These were, we can, okay. So children as co-researchers, this was a quote from one of my young person study about why it's important to include them as researchers. So now I'm moving more and more where instead of just having youth advisory committees, I don't mean in just youth advisory committees, I'm having young people on my team as co-researchers. And Stacie is one of them, and I'll talk a little bit about that project. But like this one young person said, we have a brain, so we might as well use it. So the next slide, what I'm going to show you, I wanted to ask young people, what is necessary to having young people engaged in research. So I did a focus group, and I had a graphic artist draw the key themes. I've been doing this a lot with some of my studies. So he or she would highlight the themes that the young people voiced during the focus group. We also analyze the focus group as well, but this is real time. When going to the actual focus group, there would be someone drawing it, and the young people could see the drawing as it evolves. So you see some of the things like social action, social justice. I didn't say that. I mean, when they were talking about why research is necessary, why young people need to be in research, one of the young persons talked about social action and social justice. And then one of the young person talked about imagination is more important than knowledge. And this came from a young person who was actually from an underserved community, so and had gone through lots of difficulties. So again, just to show that like young people wherever they're from have a lot to say. So again, I think this graphic recording also summarizes what some of the things that young people feel is important about research. So when it comes to actually having young people in research as researchers, what are the ways of involving them? I do think there's not just one way. I think there's multiple ways, and one of the ways is before you start your research, having a dialogue with a group of young people or their families to identify the areas of research. Another way that I've done is where I've secured funding, and then I develop the advisory committees at that point. Another way is by having young people through my website or through my Engage to suggest areas of research that need to be done. And I think the one I hope will continue with the integrated knowledge translation partnership is through my anxiety study. The young people on that study, the Youth Advisory Committee said that the next study, based on the findings and the experiences, has to be on young people who self-harm. And that we put a proposal through CHR and it got funded, and we're currently doing that study. Unfortunately, the Youth Advisory Committee for the anxiety study are no longer, they just for multiple reasons we're not able to continue on. So I have a different advisory committee for that. So I'm hoping like more and more my research will evolve through working with youth as co-researchers, and then the next study would come from their findings and their idea. When you look at the handout that's on there, I would say there's 7 main areas for that for the framework. And you can, I'm not going to go through everything on that on the handout. You can read that, and then if you have questions for me, I'm around to answer them. But I think what's key, I think that those 7 areas, the concepts are, it's really important to understanding what is the reason why young people want to engage in research. And I think it varies for every situation. And then the next concept is about really discussing the goals, being on the same, as Stacie says, you have to be on the same plane. Like it's like, you can't be going in there with one agenda and they're having another agenda. Really, really important. I think the morning speakers and first the presentation, we talked about recognizing diverse expressions of youth identity. So your people who are on young people who are on who are part of the project team, realize that they're diverse and they come from different backgrounds, and every background should be facilitated and respected. And then throughout, you may get young people involved from the very beginning, excited, but how do you maintain how do you deal with those barriers, and how do you, what facilities will help them to continue to be engaged in research? And Stacie mentioned that as well. Again, reinforcing throughout the project different levels of involvement. Some young people would like to be, really involved from the very beginning and really in-depthly, and others, due to life circumstances or other things going on, maybe only involved in certain aspects. And the next concept, just the fact of the importance of building trust. And that trust is like, I often say, I'm sure research 101, you'll say it's about building trust with your participants, and that would as well be the same with co-researchers. I almost think that trust is there right away, because here you may be somebody representing the community who's respected, but boy, that trust can be easily broken. So it's how you maintain that trust that's important. And I think lastly, really respecting different forms of knowledge, that involves the co-researchers the youth researchers on the team, and also respecting how you can bring about the different types of knowledge. So when you're engaging, and again, I just want to reinforce that when you're planning research study, it's really, really important that, you involve, again, to reinforce that the co-researchers, the young people who are researchers, have a voice and you're really listening to them. And again, I'm going to reinforce again, really recognizing everybody on the team, from the youth to the different team members, have their own individual identity, and to really provide the space that will allow them to feel like to have that equal partnership. And again, when it comes to ongoing involvement, you have to address the barriers, but also facilitators. And again, it was already been mentioned about having them. It's a chance for young people to build capacity, also valuing the time through incentives, mentorship opportunities, and so on. It's a give and take relationship. I think we learn a lot from young people, and I often, even when the young people, they're not co-researchers in research, I think you learn so much more from them. So we have to do something to, give back to them. And then again, recognizing throughout involving young people, the whole importance of really building a flexible, dynamic research partnership throughout. And I'm going to skip through a couple of these slides. The last one, I think I can't emphasize enough why it's important to have young people as co-researchers. It really, really contributes to a more culturally inclusive, a more usable research of evidence. And when we talk about communities, I think young people are the community. It's a unique cultural community, and without having them involved in topics that matter to them, I think we're going to lose something with them. And the last thing I want to show is, and Stacie, you were part of this. This is another graphic recording right now. I'm doing a research project where there's young people who are co-researchers on the team, and what we're doing right now, we're developing guidelines to conduct research in a virtual environment using arts-based methods. And this was just one of the focus groups that involve the youth co-researchers. Once we get we develop the guidelines, we're going to roll out those guidelines into an actual research study where we're going to be looking at young people and how they are transitioning out of the COVID period. So so this is, and I have to say too, all my other graphic recordings were done by professionals. And I thought, well, why not get a young person to do this graphic recording? So this is like a young person attending college in a graphic design program. And you can see some of the key things that the young people had said. And I think she did a fabulous job. So if you're ever looking for anybody for art space, go to young people who are involved in these programs. And actually, I do have one more slide. I developed this framework with my time doing qualitative research, and it's just some of the key principles in interacting with young people. And I think you can take it across the board as young people, as co-researchers as well. And actually, probably it's just about what it's like to be human to people in general. I think that's probably the key message I like to say when working with young people. It's how you would want to be treated as well. So yeah. So thank you.
Thank you so much, Roberta. I loved your presentation. I love the fact that you have a complimentary handout also for folks in the audience today to have a look at what those 7 fluid adaptive engagement concepts entail and ways in which that can be integrated into our own work with youth